Welcome to Last Days Prophecy Church. Gage, certified PN, NP, excuse me. He is going to be going over some medical stuff with you tonight concerning, as you can see, talking about the blood and things. So, anyways, I'm going to kind of let him, I don't know, how do you, I'm going to let you do this. Yeah, because I need more of an understanding myself.
So you were diagnosed recently with a condition, right?
Yes, sir. Lupus thing.
Yes,
Yeah.
lupus. So get my notes up. So to understand what lupus is, you have to understand what a few other things are, a few other medical definitions.
Yes, sir.
So do you know what tissue is? Your body's tissue.
Yes, you got tissue in your body. That's all I know.
Tissue are basically cells that are bound together, and they can form different parts of your body, different parts of your nervous system. They are the outside layer of your muscles.
Okay.
Now, you also have to understand what your immune system is. Your immune system is your body's defense system, or I guess if you want to think of it like the United States, we have the army to defend us, right? So your body has its own army.
Yes, exactly. Like when I was going, doing the honey and the baking soda, home remedy, it helps with your not your well, it helps with that too, but your immune system, and that's just amazing how you just brought up the immune system, so it just kind of fit into that category. Anyways, proceed.
And then you have to understand what arthritis is. Arthritis is a medical condition in which one's joints or other parts of a person's body become inflamed, and that can cause swelling. Inflammation is a chronic condition of swelling,
Don't I know about that?
which brings me into what lupus is. Lupus is an inflammatory disease that causes swelling inside the joints and such, but it turns into a big old giant type of disease where it makes the tissue and other parts of the body attack each other, also known as autoimmune disease, where the body's sitting here attacking each other. So lupus is a type of arthritis that makes your body attack each other, what makes it an autoimmune disease. So although that arthritis is a very hard, chronic, painful condition, lupus makes it even worse. All lupus means, and it's literally in the name, if you go into the history of how everything, break it down, how everything is, it basically just means a bunch of systems that are attacking each other. And that's really all it is.
So how do you cure it, and how do you know if you have it?
Well, getting there.
Oh, okay. Yes,
So you have to learn what the symptoms are of lupus. Lupus has many different types of symptoms. So you can get hair loss from it. You can also get pain in your muscles. You can actually get pain. Um, you can get pain while you're breathing. You can get sharp random pain in your chest,
yeah, I have that.
and it's all just because the muscles are so swollen that it causes a bunch of rapid fires in your nerves that send sharp pain up through different parts of your body. But you can also get fatigue, and you can also get a dry mouth because part of lupus you can get something called water retention, where you're not drinking enough water. Basically, you're constantly dehydrated,
Yeah.
basically, so to speak. You can also get mouth ulcers.
Get what?
Mouth ulcers.
Oh.
Ulcers are painful sores that are within the mouth. You can actually get ulcers anywhere. You can get them sometimes in your stomach, like stomach ulcers. They're just
Yeah.
big sores, really painful sores. You can also get fevers, constant chronic fevers that happen all the time. You can also get something called anemia, which is a lack of blood. We're specifically talking about red and white blood cells.
Mhm.
You can get something called myelus, which is a sense of feeling unwell. And then one of the main things that lupus does, or symptoms that it creates, is rough, red, scaly rashes,
Yeah, don't know
skin
about that.
rashes. Now, lupus also can give you a bunch of other different types of conditions because I told you it's an autoimmune disorder where all these different body parts are sitting here attacking each other, correct?
Yeah.
And because of all that, you can get many different types of conditions. So you can get kidney disease.
Huh?
You can get kidney disease from it.
Kidney disease.
Kidneys. Kidneys are in the stomach. Well, they're not in the stomach, but they're in the stomach regional area, and they're in charge basically of flushing out all the bad parts. Basically the filtration system for your body.
Huh? Is that kind of like kidney stones or? Never mind. No, that's totally different. Never mind. I've had that. That's why I kind of put
But
that
if
in there.
you're you could
Have.
kidney disease. If you get kidney disease, you might be placed on dialysis and things like that.
Right.
Now, you can also get something called cardiovascular disease, and there are many different types of cardiovascular disease. You can be predisposed to supraventricular tachycardia. You can be exposed to pericarditis,
Yeah.
which pericarditis is inflammation of the heart.
Okay.
So that's why if you have lupus, it's important to see a cardiologist on a regular basis,
That's a
a heart
It,
doctor.
yeah. Is what, like a heart doctor or something?
I just said that. Yes.
I'm sorry.
Now, something else with cardiovascular disease, what actually pertains to you, is blood clotting problems.
Yeah.
You're not able to clot very well, and sometimes you have too much blood in your system. Even though you have anemia, but your blood will decide to clot too much, which can be associated with a bunch of other things like hypolipidemia, which is a high fat volume or high lipid volume
Yeah.
in your body's vessels. So you can be predisposed to blood clots like you have, which would result on you being on like Xarelto or all these other types of blood thinning medications.
Yeah. So let me get that out real quick. I will show. Oh, sorry, baby. Oops, sorry. Oops, sorry.
Ow.
I'm sorry. Where's it at? Okay, I'm gonna get past you one last time, or for the moment. Okay, this is what it is that I have to take. It's considered a blood thinner, folks, and I will take this out.
Yeah, it's called Xarelto.
Yeah,
There's
Geralto.
Xarelto. There's also like heparin, all these anti-clotting or
Yeah.
anticoagulant medications.
And this is literally what it looks like right here. And you got to take this every single day. And I don't like it. I just got my refill today. $600 and something.
Now, there's a condition called eczema. You know what that is? It's really seen in toddlers, infants, eczema. It's basically a chronic skin rash problem that's on your face.
Yeah.
But when you have lupus, and lupus really doesn't come about, or the genes aren't really present until the ages of 20 to 48 years old.
Thanks.
But
I'm about to be 41.
so some people be like, okay, this is so and so, but it could be lupus. You can also develop other neurological problems like epilepsy, which is chronic seizures that you have to deal with the rest of your life. And there are different types of seizures. There's a lot of different types of seizures, and some seizures you're actually awake for. You can sit here and talk while they're happening, or you can be just sitting there staring off into space and have a seizure, but you're well aware what's going on. It's called an absent seizure, where it only affects about one portion or one side of your brain at one time.
Wow. That's crazy.
So you can deal with that, and you have to be put on like Ativan or Razepam, all these anti-seizure medications that help prevent and stop seizures. So you can be put on so many different medications and have all these other medical problems just because you have lupus. Now, if you have lupus, there are some medications that can help with it. But the bad thing is with lupus, there is actually no cure.
Yeah, no, I know.
But your symptoms can be relieved by some medication. So there's some immune supportive drugs like cypronamphine. There's oh my gosh, I can't even say it now. Methylphate. It's kind of the word meth is in there, so people think it's methamphetamine. It's not methylphate. Okay, but it basically helps to support your immune system, make sure your immune system can help attack foreign antibiotics.
So, a question, not trying to get you off topic, or I mean, you're still basically on topic, but not trying to get you to lose your place. But you have all this other stuff that is able to prevent it in a sense, I guess you would say. But why don't they just, in other words, to help you, in other words, your immune system, as you would say, and all that? Why did they just give me just this concerning the blood clot?
Because the person that prescribed that to you,
Dr. Schran. Yes.
the person that prescribed that to you deals with blood clots. He doesn't deal with all the other autoimmune disorder conditions and things that are associated with that. So he's going to give you blood thinning medications, since that was the main reason you went and saw him anyway.
Yeah.
So all these other things need to be brought up, and all these other medications need to be prescribed by a family doctor or preferably a different specialist, a rheumatologist, arthritis doctor. That is the person that is the main specialist you need to see. The reason he didn't prescribe that to you is not because he can't or because he's not the right specialist. He wants you to be evaluated by other people first, specialists that deal with this on a daily basis.
But he only had me going to the heart doctor, and that was just to release me for surgery, and that was it.
That was because of blood clots, and at that time he didn't have a diagnosis, and now he does.
Yeah.
And he wants you to follow up with your primary care, correct?
No.
Well, you should.
I normally do, but they don't do anything. But anyways, I mean, I'm just saying, we know how they are there.
The reason he prescribed you those no other medications is because those are the medications that he needs. That's the whole reason you even see him is for blood clots.
Yeah.
That's to help prevent blood clots. So you need to follow up with arthritis doctor or your primary care doctor and get all these other medications on board if they see fit for it.
Yeah, well, as we know, my family doctor, they can care less.
Yeah. But there's also other medications that you can be put on, such as like steroids, like methotrexate. You can also be put on prednisone.
Yeah, I have some of that.
Prednisone can be used for inflammation. It can be used for arthritis, which lupus is.
Isn't that like a little white pill or something? Yeah, I got some of that.
But it can be used for inflammation, for allergies and things like that as well. And then you can be put on some simple pain medications like hydromorphine, hydrocodone, Dilaudid, and all those medications that you might get like 1 or 2 time prescription for, which you're going to have to follow with a pain specialist. Then like Advil you can take, which is basically the knockoff brand of ibuprofen.
Yeah, and that stuff does not work.
Which is pain medication. It's got antihistamines in it, but it's also anti-inflammatory medication,
Wow.
swelling medication. And you can get all these different types of pain medication, over-the-counter medications, but you're gonna, with all these symptoms, now to get diagnosed with it, that you're gonna have to get a bunch of blood cultures. Normally they'll try to get 2 or 3 blood cultures done on you, and they're gonna run different types of blood tests. And to get diagnosed with it, you're gonna have to see a specialist, like someone that she saw, a blood doctor, to get diagnosed with it.
Because see, all I knew is like when I went up there with everything going on, we literally thought that it was from the midlines, the central lines in my neck, but just literally to come to find out by doing blood work and all this testing it is that they done, that it was a blood disorder that caused this. I mean, just anything can happen, and you just really don't know if you don't get checked.
Now, like I said, which is basically just which is do a quick overview for you.
Yes.
Lupus is a type of arthritis that causes different parts of your body, or in other words, causes your body to attack each other, called autoimmune disease.
Okay.
And it can give you a bunch of other problems like blood clotting problems. It can give you heart problems, and that would explain why you get sharp chest pain all the time, because lupus causes those symptoms because it causes so much swelling in the muscles of your chest. But it also can cause swelling in your heart, called pericarditis. But with the blood clotting issue and stuff like that, you can get a stroke, which is a blood clot in the brain. You can get a myocardial infarction, which is a heart attack or a blood clot in your heart. You can get a pulmonary embolism, which is a blood clot in your lungs, or you can get something like you had, deep vein thrombosis, a DVT, or you get an SVT, superficial vein thrombosis.
Yeah, I've had something, whatever.
So basically, it's a type of arthritis that makes your body attack each other, which makes all these other diseases and things that you just get all these other big things that happen to you.
So, what would you recommend if somebody knows about it or if they do not know about it?
What do you mean? Elaborate.
Okay, elaborate. In other words, if somebody thought that maybe that they might have, this condition like
Lupus
me.
or neuritis. I can't even say it all of a sudden. Well, I just told you, just like with you. They need to go and get it evaluated by their primary care physician. If that primary care physician with all the physical and phone with HTZ,
But what is the
all that.
main
I'm getting it.
test?
I just told you the main test was it.
Well, I know there's many, but what's the main?
But if you think you have it, you need to follow the primary care. And if primary care has a concern to back you up, then they'll be the ones to write you a referral to see a blood doctor like you saw. And the blood doctor will run blood tests and blood cultures, which are part of the blood tests. And they'll be looking at your white blood cell counts and
Yeah.
all that kind of stuff. It makes no sense to an outsider. But it's going to be a bunch of different blood tests that they'll do.
Yeah, it's not like for some of the blood work to come back with, I think, the same day, like the moment that I was there, but the rest of it takes about a week to come back. And that was done in a laboratory, not in their per se office. They had to ship it off, whatever.
Now, that doesn't mean all doctors' offices are like that. Some of them have their own on-site laboratory.
Well, yeah, but mine shipped mine off to the hospital, I guess.
So you have to get a blood test and see primary care and your blood clotting doctor to get diagnosed with lupus nephritis. Any
So,
questions, comments, or concerns?
yeah, what would you say for a person like me that is facing this issue?
You're rare.
Well, I know that I'm rare. They say that all the time.
Well, what would I say? Take the medications on a daily basis, especially your blood thinning medications, and follow up with other specialists, specifically arthritis, a rheumatoid doctor, arthritis doctor, for them to look at all your records and see if they see fit of what medications they would like to prescribe for you, since they deal with these people on a daily basis.
So you talk about arthritis. It can lead to arthritis, correct?
Lupus is arthritis, because if we go back to the definitions, arthritis is basically a medical term that describes chronic swelling, or the medical term of swelling is inflammation. So arthritis is a chronic or a long-lasting swelling in your body. So like joints.
So could that be possible? The reason why I have arthritis in my back, not the other stuff, but just that, in my hands or wherever they say that is all out, and my shoulders.
Like I said, arthritis, you can get it in all your joints and stuff, but if you have the gene of lupus, which is not treatable, but symptoms can be relieved. Again, it's an autoimmune disease. It means that that particular type of arthritis that you have is going to turn into lupus. It's going to attack all your other body cells, and it can spread out throughout your body. So this is why you have arthritis. So it can be throughout your whole body, but it's going to bring on all these other medical conditions too because it's attacking itself. So that's why you really need to watch the people you're around. Like if you're around sick people, you're more prone to being sick than others. That's why it's you need to ensure that you see an arthritis doctor so they can get you on the right type of autoimmune medications.
I mean, because, none of my doctors really, they explain certain things, but not a lot. I like my blood doctor because, Dr. Tran, because he really explains some things to me. He's really good at his job. Just my family doctor, well, they're kind of, wacko. I'm just being honest, not going to name names, but they just don't get their job done. Now that they did have some that literally did, but the new people don't really. They just, but the point that I'm getting, if you have this, I mean, I know that you go through a lot because I go through a lot with it, and you have to be careful when you're on blood thinners. You can't be around knives and a lot of different things that you have to literally be careful with because if you get cut, if you hit your head really hard, it could cause all different kinds of things. Am I right?
Mm-hmm.
And so when you have this, lupus disease, as I do have, that I don't claim it, but they say that I have, in other words, um, it's a challenge and it can get worse. And there's no cure for it at all. And the only way to know is through basically blood tests and things like that. And you just really have to, be careful. And you get the chest pains that I do know because I'm having a little bit right now. I can already feel it. But, I try to know what's the difference of that and a heartburn because some people don't understand the difference. And like if you're like in this kind of situation as it is that I am, um, you have to get up and I'm putting this in here because you got to pray. Prayer is very important, to rising up against infirmity because that's what it is.
When you were having all these chest pains and everything, and they could never find any reason why in your electrical cardiogram, the 12 lead EKG where they put all those wires up to you,
Yeah.
it was always normal, but you're always having chest pain. You never figure out why. It's because of lupus. It's because all the muscles that are surrounding your heart, and you got to remember your heart's a muscle too.
Yeah.
It's all because it was all because of arthritis and it's causing all that swelling, which causes all pain. That's why you get chest pain.
Wow. And so, I mean, I know that it can lessen some of your I wouldn't say everything, but some of your pain, like being on pain medication, and you've really got to use it correctly and wisely. And it depends on what it is that you get and how much it is you take and all of that. And prescribe all these other medications like blood thinners and immune system medication and things like that. This here it's not going to stop it, but it will help it minimize it, I guess, in a sense of. So that's for y'all's information out there, and for anyone that is a dealing with something in the sense of, that it is that I'm a dealing with.
Now, you also have another medical condition that we haven't gone over yet. And I don't know if you want to say that to a later video or not.
What is it? Well, we can wait till later to do that. I don't know what it is, and I'm a little tired. But anyways, so just go get checked if you think you're dealing with something like this.
And you're darn right. Without any blood work, I diagnosed you with it. Because your doctors, your healthcare doctor, your primary, they don't have to do nothing. So
Yeah.
I diagnosed you with it.
But
And I can diagnose people.
so the thing is that if you've
I've
gotten
seen
some,
your lab work.
if you've gotten something like this, make sure you go get checked. Make sure you take all your medications, but always be in prayer. Pray for your healing, claim your healing, things like that, because that is very essentially important. This is how it is that I was able to battle the things that I've battled throughout this whole time of fighting for my life, because it's what it is that I literally have done and still doing today. I went to the doctor, got another infection in my ear. So we've already went over that, I think, hadn't we?
What?
The ear infection. That'll be for another video in the future. But anyways, you've got to warrior up, because when you're sitting here, helping many people like I do, the enemy tries to inbound and attack you. And this is where God wants you to warrior up, and not give up. And I know that you're like, this is a medical video. Well, I also talk about God, and that's very important to me. God is very important to me. Jesus, God is very important to me. Giving people information is dearly very important to me as well. But we just wanted to bring all of this to you just in case you are facing something like that. And once again, this is the blood thinners it is that I do take. And I'll show you one last time. See, yeah, Geralto. I could never remember that. Like, literally.
You can't even say it.
Geralto.
Zeralto.
I just said it.
No, you do not.
Okay, anyway. Um, these are like this, folks. They are basically little reddish little pills. It is that you have to take every single day, on a daily basis. You got to take one a day. And mine, they're in different milligrams. Mine is 20 milligrams. And it depends on where it is that you get them at. But if you get them at Walgreens, that is my pharmacy, that is literally $600 for this. But if you look up online, you are able to get a discount. It depends on your state, your town it is that you live in. But by the grace of God, I'm able, occasionally to be able to get a discount, because I cannot afford $600 a month. It's way too much. But, anyways, um, with my condition, you don't need to miss a dose of this, because this helps prevent more blood clots. Not saying that it won't, stop the blood clots. It will help prevent. You know what I'm saying?
You how to keep your word.
So what it is that I do is I know that I can't afford these. You know what I'm saying? $600 a month. So I shouldn't do it, but sometimes you got to do what you got to do. Sometimes you got to, skip 2 or 3 days. You know what I'm saying? Or a day. But I wouldn't encourage that if you can afford it. Buy. You know what I'm saying? But I've got so much medication it is that I have to buy 10 things of medication, if not more, that I have to buy every single month, and that's a lot of medication. Um, but anyways, I've got to do that. You know what I'm saying? It's just what it is. And with new medication, it is that they, constantly give me as well on top of that. But just for this one alone, it's $600 at Walgreens. If you don't believe me, look it up, do your research. And like I stated, you can get a coupon for it. In some places, it might vary. So that's why I'm saying just look, and I encourage you, any kind of prescription it is that you get, and if you don't have like insurance or something like that, always look online to see if you can get a discount. And let's just say you do have insurance, but your insurance won't cover that certain medication. Okay, like in my case, make sure that you go up online and you go and Good RX. There's many other ones it is that you can go to and be able to type in your medication, the name of your medication, and the milligrams of your medication, and also how much that it is that they give you. You know what I'm saying? And
Like
put all of
quantity?
that, huh?
Quantity.
Yeah, and the quantity, and put all of that in there, and it will show up. You know what I'm saying? And there will be many different discounts it is that you'll be able to have. So with that being said, folks, I love y'all. Thank y'all for tuning in. And I'm going to get off here. I'm going to rest the rest of the night, because we've done like 3 or 4 videos they've been. And tomorrow I've got a long day ahead of me as well. And I've got a long day next week ahead of me as well. I'm pretty booked up. I've got like 3 or 4 doctor's appointments next week, and a few after that as well. So meetings after meetings, also. So and I've still got all of this to do. So just bear with me. I'm getting there. I'm fighting through the things it is that I'm going through. So just as well as you. Those things are so nasty. I'm just saying. But anyway, folks, I love you and God be with you and thank you for tuning in. Amen.